Good afternoon, everybody. I'm Sayukta, your host for today's live from All About Skin Allergy team. I'm sure all of you must be keeping good health. Today, we are going to discuss about our skin health with focus on Artecteria or hives, which we or our near and dear ones would have encountered at some time in their lives. Artecteria is characterized by a round rash on the skin that itch intensely. It may be due to the chemicals present in certain food items, allergy to certain medication, insect stings, sunlight, and sometimes the cause is unknown. As per study published in Indian Journal of Dermatology, Venereology, and Leprosy, more than one-fifth of the population suffer urticaria at one point of time. 60% of patients are in the age group of 20 to 40 years. Incidence is higher in older age groups. Urticaria is classified as acute and chronic, but the most important part is not to ignore it, and doing self-medication can worsen its symptoms. Consult your nearby qualified skin specialist immediately for an early remission. In today's digital world, it's a boon or blessing if we can get to hear from an expert dermatologist online about urticaria and its types, how we can prevent it, kind of test required for its diagnosis, and right treatment and management approach for an early relief. So, ladies and gentlemen, girls and boys, we have with us renowned dermatologist of India, Dr. Shehla Agarwal, live from Mehak the Derma and Surgery Clinic, New Delhi. And she will educate us more about urticaria and its management. Dr. Shehla is a graduate and postgraduate from Maulana Azad Medical College. She has been in practice for 22 years in the field of dermatology, venereology, and leprosy. She's a very famous dermatologist and venereologist. Dr. Shehla conducts many workshops for public education on skin care, anti-aging, and also other skin and hair related problems all over the country and abroad. Welcome, Dr. Shehla. It's a pleasure to have you with us today.
Thank you so much. And Sayukta, it is the allergy season. It's an
Oh,
extreme heat. So daily I'm getting like lots of people who never had allergies and are now facing it. So this is the right time for us to discuss urticaria.
very well pointed out, Dr. Shehla. So let's start the whole discussion as we are today going to talk about urticaria and its management. First of all, I would like to know what is urticaria? How do we understand urticaria?
Urticaria in common language, people call it chapaki or allergy. Like whenever the skin is irritated, urticaria has stages. Like there is a triple response. We call it a triple response: itch, wheal, and flare. What happens is that there is itching in a certain area. When you itch the area, it becomes red. And after redness, there is flare. Flare means that it's almost like the ants biting you. So there is a small swelling. Now, in majority of the people, like as you correctly said, that one-fifth of the people will experience urticaria sometime or the other in their life, all age groups. So when people come and tell me, oh ma'am, I never had it, I'm having it for the first time, I said, whenever your number comes, it's actually like that. So ideally, this urticarial symptoms should pass away on their own within 20 minutes. If they don't pass away in 20 minutes, it means that the allergic reaction is severe and it needs treatment. So there are lots of people who, when they come out of the bath, they have redness all over the skin, but usually it subsides within 10 to 20 minutes. There are certain people who are wearing the tight garments throughout the day. When they take off the garments, then there is urticaria. So urticaria is as a symptom can be there, but if it doesn't heal on itself, then it becomes a disease process, basically.
Okay. So that's the basic idea about urticaria. I would also like to know that is it an allergy? Because initially you said this is the time when the most allergy happens. So is it a kind of allergy, and how does it look like? Definitely you have said that it's red, it will be a little swelled up. How can we identify an urticaria?
Urticaria is the function, like whenever there is an infection in our body, we get the blood test done, we get a hemogram done. In the hemogram, we are always looking for different kind of cells. The white blood cells are the one which are the protectors of our body. Like RBCs, red blood cells are the oxygen carrying capacity, and white blood cells are the avengers of our body. So if there is a bacterial infection, there is increase in neutrophils. If there is a viral infection, there is increase in lymphocytes. Similarly, there is a cell called eosinophils, which when they increase in the body, they cause urticaria or allergy. What happens is, like as I was talking about a pointed urticaria, okay, there is a pressure, you get urticaria. These days, as I talked about the sun, so there is lots of redness on the face. The eosinophils are moving around with the blood in the blood. What happens is they reach a place where there is inflammation or where there is allergic this is called allergic reactions. The eosinophils reach over there. What are cells? They are just packets of enzymes. They reach there and they burst. When they burst, the enzymes that they have come into the bloodstream and cause all these symptoms. First of all, it will be just mild itching. Then after that, there is redness, and after that, there is swelling. So if the number of eosinophils is more, if it is increased, as I am talking about sunburn urticaria these days, then the reactions or the symptoms, they persist for a longer time and they don't heal till you take an anti-allergic. In 90% of the cases, you take an anti-allergic, lots of people take it over the counter. It's okay. There is no harm in it, but it should not become technically, if in 72 hours means 3 days, you are required one anti-allergic, it is okay. It means that your body is having slight reaction, but it is able to control itself. But if you need an anti-allergic on a daily basis, it means that because anti-allergics are just taking care of the symptoms, they're not taking care of the basic procedure which is there. They're not reducing the eosinophil cells. They're not reducing the allergic component which is there. So the rule is that if you need one anti-allergic every 3 days, fine. But if you need it daily, you have to consult a doctor. And we will talk about acute and chronic urticaria also. So that will be another matter.
Definitely. So this is how urticaria looks like. So viewers, if you see some, symptoms or similar symptoms, please go and consult your dermatologist for relief. Doctor, one more thing is, what are the causes? What are the main causes responsible for urticaria?
Some people are more allergic, like their allergic potential is more. So something which will not bother you and me will bother them. So that is another category. And normally this is genetically related. So 30% of the people, like if the parents had urticarial tendencies, they'll have it more. Second category is that where it is the change of season, where different seasons, like the sun becomes a cause of urticaria. In winters, the dryness becomes the cause of urticaria. Then the urticaria is according to the different things you are using. Like there might be certain cloth which you are wearing, and especially the tie and dye kind, in which in this sweat, lots of people get urticaria because of the tie and dye cloth. Again, if then there are physical urticarias, it means there is pressure urticaria, there is cold urticaria, there is heat urticaria. So these are specific things. And then there are food urticarias. Food allergy is very, very specific. Food allergy is something which happens immediately. People always come to us when they have allergies and they say, oh, should I stop eating something? If you are allergic, if you are in that phase of your cycle where everything is causing allergy, then you will attribute it to every food. So food allergy is something like, normally it is the seafood allergies or the cheese allergies, but that happens immediately. Then another concern people have is the dyes. Everybody is coloring their hair and they always try to correlate to the dye. The hair color allergy is again very specific. It's very local. So it's not that everything will cause allergy. And frankly speaking, everything can cause allergy. It depends on your system. It depends how much immunity you have, how much care you are taking. If you are neglecting urticaria, then everything starts becoming an allergen. And one more thing, there is the airborne contact dermatitis, which is change of season urticaria. Whenever that's September, October, and March, April, when the pollens are more, when the flowers are flowering, that's the time lots of people develop urticarial symptoms.
So there are n number of causes, and as the doctor have very well said that anything actually can cause urticaria. So it depends from individual to individual. What has caused an urticaria to one person may not be the same reasons may not be responsible for the other person's urticaria. Dr. Shehla, how serious can urticaria be? Is urticaria itself a serious disease?
99% it's not serious, but it is one of the emergencies that dermatologists deal with. Because once it becomes severe, then it looks very dangerous. There are wheals all over the body. There is swelling all over the bodies. The eyes can swell up, the lips can swell up. And at that time, you need injectable treatment, because at that time, if you take an oral anti-allergic, it's not going to help. So it's not that suddenly people land into an emergency. It's always a gradual process. If you have been neglecting, then you will land up in that area. And once you have landed up in the hospital where you are given injection Avel and injection F-colon, then the chances that you will have a repeat infection is much, much more. So always, that's why our talk is very important, because people have to understand that you cannot neglect symptoms, though they might be very simple. Saita, the problem is that there are two spectrum of people. Some people are not bothered at all, and some people are too bothered that they want to get the allergic test done and they want to do all the blood tests. So both extremes are not right. For allergic test, there is a specific condition. For allergic test, there is a time. You cannot get it done when you are having acute urticaria, because then everything will come false positive. Once you have urticarial symptoms, so even whatever dal, sabzi you are eating, you will attribute your itching and allergy to that. Secondly, if you are taking anti-allergics and you get the blood test done for urticarial symptoms, then everything will come negative, false negative, because you are taking anti-allergics, so the symptoms are being suppressed. So there is a specific time for every test. I actually want to request people, because what people have started doing is they have just started going to the labs and please do my blood test for allergic symptoms. And it's a costly test. It's around 20,000, 30,000. And the result will come that you are allergic to dust and cockroaches. So in India, you can't escape dust and cockroaches. So unless and until you are getting it done at the right time, you have to be 15 days disease free and medicine free. Then only those tests are valid. So getting the test done on oneself is not a good idea unless and until your doctor prescribes it. Don't waste your money and time.
Fair enough. I think it's a very valid point. Viewers, please, अगर आपको कोई भी symptom है, उसे ignore मत कीजिए, because अगर वो आप ignore करेंगे, urticaria है, तो वो बहुत serious हो सकता है. B, खुद से medication बिल्कुल नहीं करना है. And C, and a very important point, अगर आपको लगता है कि कोई एलर्जी है, please go and consult your doctor, a dermatologist in this case. खुद से बहुत सारे टेस्ट कराने का भी कोई फायदा नहीं है. आप सिर्फ अपना टाइम, एनर्जी एंड पैसे वेस्ट करेंगे. Doctor, one more thing. Initially, you said that we'll talk about acute and chronic urticaria. So now I would like to know about the difference between acute and chronic urticaria hives.
It is basically the time frame. If your urticaria has been there for 2 weeks, and still is persisting with treatment, then it's called acute urticaria. If it persists beyond 2 weeks, then it is called chronic urticaria. So first of all the urticarias are acute, and if you don't take care of it, they do become chronic, and the chronic means long time. So don't let it become chronic. Another thing over here is, once you get urticaria, your blood work, we always get something called as IgE, serum IgE, immunoglobulin E tested. It's a residual test, in the sense it will always show whenever you had urticaria that you had something in the body, and it will not come down for a very long time. So why I'm saying this, that acute urticaria, people get treated, but then they get the test done and the test shows the higher levels, and then they are again panicking. No, that test is not going to come down. 99.9 people get treated in acute urticarial phase, and they will not have the urticarial problem again. If it is a seasonal thing, then you have to be aware that it is a seasonal thing, and next year you'll have to take care. It's only that 0.1% who become chronic, but chronic urticaria, there is not a single patient in the world who's not being treated. The only problem is we can't predict. Will it be okay in 2 weeks? Will it be okay in 2 months? Or will it be okay in 2 years? But everybody will get treated. That's very, very important.
राइट सो द बॉटम लाइन इज कि अर्टिकेरिया अगर क्रॉनिक है, एक तो अगर अक्यूट है और हमने उसे इग्नोर किया तो ही वो क्रॉनिक बनेगा
क्रॉनिक
जब वो एडवांस होगा, लेकिन अगर वो क्रॉनिक है तो भी वो ट्रीट किया जा सकता है,
बिल्कुल।
लेकिन कितनी देर में कितने दिनों तक ट्रीटमेंट चलेगा ये कह पाना मुश्किल नहीं है। डॉक्टर, ऐसा होता है कि पेशेंट जो है अपना ट्रीटमेंट थोड़ा सा जैसे ही आराम मिलने लगे, क्रॉनिक अर्टिकेरिया के केस में वो ट्रीटमेंट वहीं पे रोक दे, उसे लगे अब तो मैं ठीक हो गया, फिर से जब सिम्टम्स दिखने लगे तो उनको लगे कि मेरे पास प्रिस्क्रिप्शन तो है ही, they'll go and get the medicine and again they'll get the relief। तो ऐसा करना क्या ठीक होता है या आगे जाके वो हार्मफुल या डेंजरस हो सकता है?
इसी वजह से संयुक्त ट्रीट नहीं होता है because
I can
first of all
understand.
people do doctor shopping, so you go from one doctor to another and there is a protocol to everything, that the first step will be this, second step will be this. If you go to a different doctor, the doctor will start from step one only, so you'll be just climbing two stairs, then come down, climbing two stairs. So I always request my patients that kindly don't leave me till you get okay, because I am responsible for you, and once I am responsible for you, so I'll have I'll have a symptom wise treatment what we have to do. And secondly, it's a human these are few things which I always tell the patients: please, dawa okay, don't try and see will I get it again or not, because everybody has this tendency. Once it gets okay, if I've told them to take it for 15 days, 10 days they're okay, then they'll say, oh, let me see whether I get it again or not. So whatever I have done for 10 days is wiped out. So there is a very, it's not arbitrary, like medicine is not arbitrary कि आज मेरा मन किया मैंने लिख दिया 10 दिन खा लीजिए, आज मैंने मन किया दिया कि now you take it for 2 weeks. There is a specific way of doing things, there is a specific way of titrating things, and sometimes there are medicines which are needed. In acute urticaria cases, we do need to give mild steroids in addition to the anti-allergics. Now everybody has a steroid phobia. The phobia started because everybody started taking steroids because they work. जो काम ही नहीं करता उसको लोग लेंगे क्यों? Because it works, so people started consuming it. As you said, that the prescription is there, so you repeat it, you get the relief, and once then because you have been repeating it, you get the side effects after 2 years, and then you come back to me and said, "Okay, ma'am, you gave this. I gave it only for 5 days."
Right.
So the whole idea, steroids, why I want to talk about steroids is because steroids are a magical drug, and without steroids half the world would be suffering from urticarias and lots many things, but it has to be used judiciously. So in smaller doses, what we dermatologists use, it acts as an anti-inflammatory, so it reduces the inflammation and allergic potential. Similarly, if we use a higher dose for a longer time, then it will cause immunosuppression and will cause all the side effects. So if the doctor is writing something, the doctor is well aware of what the person is doing. Medicine is not, it's a profession of responsibility. I'm responsible for your well-being. And again, the treatment is done of a person, not of a disease. So if you're a diabetic, if you're a hypertensive, so I will take care that I don't give you this, or I look into this. And there are multiple medicines also. There are combinations of medicines which people have been taking, and they don't even realize that that is causing an allergic potential. One of the very common medicines which causes dryness and allergy is anti-cholesterol medicine. So it's become a fashion that if your cholesterol is even 180 to 250, so you start taking statins. So that in itself, you might not realize it, but that might be one of the causes. So we are, first of all, if a person with acute urticaria comes, I am more interested in treating the acute urticaria. As I said, in 99% of the cases, it will be treated and you will not be bothered with the urticaria again. But if it's not being treated and if it becomes chronic, we are working with you. So kindly don't doctor shop and don't reuse the prescription and again and again.
Yeah, very well said, doctor. I think it's important to understand, viewers, that if you're going to a doctor, please trust your doctor. The doctor is definitely responsible for you and your health. They'll take care, they'll consider everything that they know about them. So please be really open with them when you tell them your history, your complications, your problems, etc., and trust them. That's really important. Doctor, now I would like to know, what are the potential complications of urticaria if left untreated?
The most important complication is that acute becomes chronic. So it's always bothering you. So, and the problem is that initially it might have started as an airborne contact dermatitis, it was seasonal, or it was a local dermatitis, but you didn't treat it. So it became chronic. Chronic means that the number of eosinophils also have increased in your body. Once you have increased eosinophils, then the urticarial complications, the complication is basically you are troubled all the time. Imagine if you're sitting in a meeting and you're itching, your body is burning, your skin is burning. So that becomes an issue. And we always want to give local applications also, which are soothing applications. Calamine lotion is a very soothing application, but calamine lotion can only be used in summers. You cannot use in winter because it will dry the skin and make it worse. So you have to understand that there is no absolute treatment. If these days, as I told you about the sunburn and the sun urticaria, somebody came who had done hot compresses, the skin actually burst open. If it is 45 degrees outside, why do you need to do hot compresses? You have to do cold compresses. So the problem is that urticaria in itself is not an issue. What we do to treat it becomes an issue sometimes. So what you're doing cold compresses or hot compresses. Aloe, people are very fond of aloe gel. We have aloe plants at home and we break them. It's okay. It's an anti-inflammatory, but it will only work in summers. It will not work in winters. Then there is something called as kapoor, camphor. So that lots of people use, but that will work in winters. That will not work in summers. So whatever you are using, that can cause a bigger problem. So urticaria is something, if you have, you don't even need to go to a dermatologist. You go to your general practitioner, whoever is your doctor. Just don't ignore it. That is what I want to say.
Exactly. So the most important thing is don't ignore the symptoms, don't ignore your urticaria, go and discuss it with a doctor and don't waste time doing all the home remedies. You may end up, doing the wrong technique at the wrong time. So please go and consult your dermatologist before it becomes too late for you. तो बहुत जरूरी है कि हम सेल्फ मेडिकेशन ना करें या बहुत ज्यादा होम रेमेडी गलत तरीके से कर देंगे तो वो ज्यादा खराब हो जाएगा। अच्छा डॉक्टर, मैं ये भी आपसे जानना चाहूंगी, आपने कहा कि कई बार बहुत अजीब सी सिचुएशंस हो जाती है, ऑकवर्ड सिचुएशन हो जाती है बिकॉज यू आर कंटिन्यूअसली इचिंग। तो ऐसे में स्ट्रेस तो डेफिनेटली आर्टिकेरिया से होता ही होगा पेशेंट्स को, लेकिन क्या स्ट्रेस की वजह से भी आर्टिकेरिया होता है?
Stress in itself will not go and cause urticaria. Stress reduces your healing power. Right. If you have eosinophils, we all have eosinophils, 0 to 6 eosinophils, 1 to 6 is normal. And that normal eosinophil is not going to cause you itch. But if you are stressed, because your healing power is not there, that 2 eosinophils also will start cause you itching. So once stress is something which has been in our lives for past 2 years, everybody has been stressed and the immunity has gone down as such. So to increase the immune power, as I told you, Samyukta, in acute urticaria, we are more concerned that we give the medicines, the urticaria gets okay. When we are stuck with chronic urticaria, then we are also more bothered than the patient also, because it's our responsibility to treat. So then we start looking into the whole lifestyle. We actually ask the patient to do the pranayam or positive breathing, because once you take care of the positive breathing and the free radicals in the body, you have to understand stress is something which releases serotonin. Serotonin is a hormone which reduces everything your body does on its own, whether it is healing even when if you're doing a walking, your strains, your ligaments are strained. If you're heated up, then your body becomes irritable. So the chances that if the person is stressed, they will have something called as cold urticaria, hot urticaria, pressure urticaria, which is part of all our lives. Like having a hot bath or having a cold bath or wearing tight garments, we all do it at all time, and then we don't become allergic or we don't have urticaria. But if you are stressed, then those same things will start causing you problems and you will become more stressed. It becomes a vicious circle. It becomes a very vicious circle.
Yeah, it's actually looking to me like a vicious circle only. Stress, urticaria leading to stress, and again stress due to urticaria.
So you have to get the positivity in between to break this vicious cycle.
So de-stressing is important, and as the doctor has also advised that, yoga, pranayam, they'll just soothe you. It's very important. So doctor, when a patient comes to you, along with the medical treatment that you do you try to also, psychologically or mentally counsel the patient? Because anyways, he is going through a lot of stress.
Exactly. what works is counseling, and that's why every doctor is different. How much time you spend with the patient is more important. All of us write the same medicines. It's why people come to me from so far, or why they go to a certain person, because they like how the person deals with it. So
Right.
unless and until you are counseling the patient, it's not a robotic job that you come and you tell me I write two things. I have to look into your lifestyle also. I'll ask you 10,000 things. 90% people, when I ask you, do you go out in the sun? Nobody goes out and stands in the sun at 45 degrees. But at home, people are cooking. Ladies are cooking and they are standing in front of the gas. That is worse heat than standing in the sun. So unless and until you talk about their lifestyle and you ask if what all they are doing, so you will not be able to treat completely. So counseling is definitely uh, counseling is not definitely like, I'm sorry, I was reading. You read and tell me, Sayukta, otherwise I'll keep on reading.
No, I'll do that for you, doctor. I'll do that for you.
Otherwise, we get distracted by something which is coming up on the screen.
Yeah. So I'll do the reading part. I'll read you the questions of the viewers that they are asking us. But before that, as you have just mentioned the word distraction, I want to ask you, because many patients at times say that their urticaria get worse at night. What's the main reason behind it? One is not many, distractions, as you just mentioned. Or what is it exactly?
All the skin itches become worse at night. Whether it is an allergic itch, whether it is an infective itch, even fungal itches, even scabies, everything, because skin gets the maximum circulation of blood at night. We have a limited amount of blood. We have 4.5 liters to 5 liters of blood, and it is running throughout the body doing different functions. So once you are thinking, it's going to the brain. Once you are eating, it's going to the GIT tracts. Like, but it's always said, don't swim after having a meal. Why? Because the blood circulation is going to your GI tract to absorb the food. And if you start swimming, then the blood has to be distributed evenly. So at night, the skin gets majority of the blood circulation, and that's why all the itching start around when you are starting to retire to bed, and that is the time. First of all, there are no distractions. The mind is at peace. The skin circulation becomes more, so all the allergens itch you more.
And does urticaria makes a person tired?
Because you are constantly stressed. Like if you're sitting in a meeting, you're stressed. If you're like continuously, if you remove your clothes, then you start itching over there. So yes, definitely it makes you mentally tired more than making you physically tired.
राइट और जैसा कि आपने कहा कि रात में भी कई बार नींद नहीं आती क्योंकि
Exactly.
वो itch जो है वो और ज्यादा वर्स हो जाता है, तो ऐसे में लैक ऑफ स्लीप अगेन कैन मेक अ पर्सन टायर्ड. कुछ व्यूअर्स के क्वेश्चंस हम ले लेंगे डॉक्टर शैला. ईशू मेहरा पूछ रहे हैं, व्हाट आर द कॉजेस ऑफ अक्यूट जनरलाइज्ड अर्टिकेरिया?
Acute generalized urticaria can be seasonal. It can be, as I said, according to the weather. If you have been out, if there is a change of routine. आजकल जो लोग हैं समर वेकेशन से बैंकॉक और सिंगापुर घूम घूम के धूप में खड़े होके आ रहे हैं, so there you get it. So acute urticaria, as I again want to say, issue, we just want to treat it. We don't want to look into the causes too much, because आया है चला जाएगा सही दवा से, उसमें कोई दिक्कत नहीं.
ओके, तो आया है तो चला भी जाएगा, बस इग्नोर मत कीजिए. पंकज दुबे इज आस्किंग, व्हाट इंफॉर्मेशन अबाउट अर्टिकेरिया शुड अ पेशेंट रिसीव?
शुड अ पेशेंट रिसीव,
आई थिंक ये पूछना चाह रहे हैं कि क्या क्या चीजें जानकारी होनी चाहिए एक पेशेंट को अर्टिकेरिया.
अर्टिकेरिया ये है कि एज आई सेड कि फर्स्ट ऑफ ऑल इट्स अ ट्रिपल रिस्पॉन्स. इच व्हील फ्लेयर, पहले आपको इचिंग होती है, फिर वहां पर रेडनेस होती है, और उसके बाद स्वेलिंग हो जाती है. अगर वो विद इन 20 मिनट्स ठीक हो जाती है अपने आप, आपने कुछ नहीं किया, आपने कोई कैलामीन एलोवेरा कोई एंटी एलर्जिक नहीं की, विच इज नॉर्मल. इट इज जस्ट पार्ट ऑफ अ इच व्हील फ्लेयर रिस्पॉन्स. अगर आपको हर 3 दिन में एक बार ऐसा हो रहा है और आपको 3 दिन में एक एंटी एलर्जिक लेनी पड़ रही है, दैट इज ऑल्सो नॉर्मल. अगर यही चीज आपको रोज हो रही है और बगैर एंटी एलर्जिक के ठीक नहीं हो रही है, तब आपको अर्टिकेरिया हुआ है. तो हर इच अर्टिकेरिया नहीं होती. Not every time you itch you have an urticaria. There are specific criteria for urticaria.
Okay. Tripti Pandey is asking, what about natural remedies like eating local honey, etc.? Do they help?
No, they help in, as I said, कि अगर आपको itch feel flare हो रहा है या urticaria हो रहा है, आप अपनी लोकल रेमेडीज ट्राई कर लीजिए, अगर वो काम कर रहा है बहुत अच्छा है, बिकॉज सबका अलग है. नॉट, आई कैन नॉट गिव अ जनरलाइज थिंग कि आप हनी खा लीजिए तो सबका ठीक हो जाएगा. सो द अकॉर्डिंग टू द कॉजेज एंड अकॉर्डिंग टू योर लाइफस्टाइल एंड अकॉर्डिंग टू योर इम्यूनिटी, इफ इट हेल्प्स यू. बट रिक्वेस्ट वही है कि अगर 72 घंटे में 3 दिन में आपको बार बार हो रहा है और एंटी एलर्जिक से और आपकी लोकल रेमेडीज से ठीक नहीं हो रहा है, लेकिन बात वही आ जाती है संयुक्त, जैसे हम लोकल रेमेडीज की बात कर रहे हैं, होम रेमेडी सब लोग सोचते हैं कि बस सेफ है. How is it? It is safe, but you have to understand that how it works and where it works. So summer, winter, you have to take care that if you eat honey in summers, and there are certain people who are actually allergic to honey, so that has to be taken care of. I am not saying that the moment you start itching, you run to a doctor. You see, is the itching getting okay? You can take over the counter anti-allergics also. There is no harm in it. As long as you require an anti-allergic every third day, I'm okay with it. With time, it will get okay. But if you require anti-allergic daily, or the allergy is Urticaria is disturbing your sleep, then you have to come to a doctor.
ओके, तो तृप्ति को अपना आंसर मिल गया होगा. यहाँ पे पवन शिंदे है, पूछ रहे हैं, हाय डॉक्टर, आई एम गेटिंग सिवियर अर्टिकेरिया आफ्टर टेकिंग एलर्जी मेडिसिन. उन्होंने कुछ नाम भी मेंशन किए हैं. आई एम एलर्जिक टू ऑल एलर्जी मेडिसिन. नाउ आई एम गेटिंग ब्लड एंड यूरिन, प्लीज हेल्प.
No, it's actually very rare to be allergic to allergy medicines. Like Atrax, cetirizine, etc. They have written that what I'm saying is that when you are having an allergic tendency, whatever you are eating, whatever you are taking, whether you are taking anti-allergic medicines, whether you are taking some food groups, whether you are wearing something, whether you are using a hair dye, you will attribute it to the allergy, to those things. So I would request, now this is the time, blood and urine, it's not possible that you are allergic to allergic medicines. I don't know who you're consulting. Definitely go to the doctor. What we do is, because everybody there are people who are very happy with cetirizine. There are people who feel very sleepy with cetirizine. There are people who are okay with Atrax. So everybody has a very specific anti-allergic which they are comfortable with. So what we do, we give the most common thing. If you are allergic to it, then we change it over. But for any change, you have to give it at least 24 to 48 hours to say. नहीं तो आप हर चीज को बोलते चले जाओगे you are allergic. पर एलर्जी तो आपकी ठीक नहीं हो रही ना, that means you are allergic. So Pawan, I would really request that you go to a doctor, do a detailed history that what is causing you, and then what we do is we stop everything and we start one by one so that we know what caused it or what healed it.
राइट, तो आई थिंक ये एक बहुत ही अच्छा सजेशन होगा पवन आपके लिए. रेणुका बैनर्जी इज आस्किंग, इज इट सेफ टू टेक एन ओवर द काउंटर एलर्जी मेडिकेशन एवरी डे?
Not every day. Renuka, if you have been hearing me, if you need it every day, then you need to go to see a doctor. If you need it twice a week, it's okay. But if you're needing every day, it means you're just suppressing your symptoms. You're not treating it. So if you need anti-allergic every day, you need to get it analyzed, that what is causing the allergy, and it needs to be treated, because then it has to be a proper prescription.
Right. So Renuka, please don't waste time. Go and consult a doctor. Okay. Doctor, as we were talking about, that some people also are allergic to certain foods or ingredients in any food item. So is there any dietary precaution or do's and don'ts for patients of urticaria?
If it is very evident, like you come and tell me, the most evident allergies, food allergies, are the seafood allergies, because in India, we don't have seafood in that level. And seafood means the crabs and the lobsters, basically. Fish normally doesn't cause that much allergy. It's a specific enzyme, catecholamines, which are causing the allergies. Right. But if it's something which you can't figure out, so what we do is we ask the patient to maintain a food diary. And this all happens once you have become okay. You maintain a food diary. If today you have allergy and I ask you what you ate 24 hours ago, you will not be able to, what you ate 2 days ago, you will not be able to tell me. But if you have allergy right now and I ask you what did you eat for lunch or breakfast, you might recall. So what we do is we ask the people to have a paper and pen on the fridge, and whenever they feel any allergic symptoms, just write down what they have eaten. So then after analyzing for a week, we will be able to at least reduce that what is causing the allergy. But this is not in the acute stage. Acute stage may everything you are eating is causing allergy. Even if you drink water, you will say it's causing you allergy. So first you get the allergy treated, and then we go and decide if for food allergies, the maintaining a food diary is the most important.
राइट, तो फूड एलर्जी के लिए ये भी एक अच्छा एक्सरसाइज है, अपने फ्रिज के ऊपर एक स्टिक ऑन पेपर चिपका दीजिए, उस पर लिख दीजिए जब भी आपको लग रहा है कि कुछ,
जब आपको लग रहा है कि खुजली हो रही है, तो आप सोचिए आपने क्या खाया था और उसको फटाफट मेंटेन कीजिए।
डॉक्टर, एलर्जी के साथ, स्पेशली स्किन एलर्जी के साथ, लोगों का ये नोशन होता है कि वो एक दूसरे से फैलता है। सो इन केस ऑफ आर्टिकेरिया, इज इट कंटेजियस?
No, not at all. Not at all. It's your cells causing distress to you. They are not going anywhere and you cannot transmit it. As I said, there is a genetic predisposition. If one of the parents, either of the parents have allergy, the chances that the child will be more allergic is there. But it's not because they have contagiously passed it on, it's they have genetically passed it on. So you cannot, because eosinophils are not getting transferred. What happens, Samikta, is sometimes it's an infection. Like this is the season of fungal infection. So a fungal infection, if you're sharing towels or if you're using the same comb where there is lots of dandruff, that can transmit, and that in itself causes allergy. That in itself causes itching. Now, the causes of itching are infectious also. Na? If you have fungal infection, if you have scabies, that is also itching. But every itching is not allergy. So allergy is not passed on. It's not contagious. You cannot pass it on to anybody, whether by close contact or by staying in the city.
Right, very well explained, Doctor. Sneha Mehta is with us asking, मैम क्या स्वेटिंग के कारण भी एलर्जी बढ़ती है? क्योंकि मुझे इचिंग और हीट जैसा फील होता है, 5 days हो गए हैं।
बिल्कुल. This is the severe weather. As such, as I told you, in this weather, the skin is burning. There is a the skin is one organ which is actually, whether it is 45 degrees or 2 degrees, our internal temperature is maintained at the same time. So it's the skin's job. How does the skin do it? The skin does it. If it needs to cool down, then there'll be lots of sweating. So if that sweat accumulates on the body, sweat is NaCl, which is the salt. So if you are not removing the salt properly, then the skin will become irritated and start itching. So if you have sweating, first thing, you have to have a bath at least twice a day. Secondly, don't use antiperspirants. Like there are certain things available in the market which reduce the sweat. You don't need to reduce the sweat, because sweat is important to maintain your normal body temperature. Otherwise, you will feel heat exhaustion. You will not be able to control that heat. Use talc. And talc, the only problem is that it forms clumps if you just sprinkle it. So what we have to do is we have to take it in our hands, do like this and apply. So it forms a layer, it absorbs the sweat, it reduces the irritation, but it does not form clumps. And secondly, always, younger generation comes and tell me, ma'am, wo auntie ki tarah laga le. Auntie ki tarah lagane ki zarurat nahi hai. You don't need to. Just take this or just take a compact powder. If you're worried about it, the white powder showing it, the idea is the powder. We live in tropical country. We have to maintain our skin hygiene according to tropical conditions. We cannot ape the West and do the deodorants and roll-ons.
Exactly. तो स्वेट होना एक तरह से अच्छा है, वो आपके बॉडी टेम्परेचर को मेंटेन करता है, तो उसे रोकने की कोशिश मत कीजिए, उसे डील करने के लिए as very well Dr. Shehla said, talcum powder is there used.
Exactly.
एक और क्वेश्चन यहाँ पे, रिया अंशुमन शर्मा, आई एम 7 weeks pregnant. Congratulations first of all, Riya, and have absolutely no symptoms. Is it possible to have no symptoms during pregnancy? I'm not sure what she's talking about.
She is talking about pregnancy symptoms. There's no vomiting or anything. It's nothing to do with urticaria.
We are so sorry, Riya. Anyways, we are very happy for you.
No,
please.
It's Riya, it's okay. Not everybody has the filmy vomitings and discomfort. It's okay.
Yeah. So please go and check with the gynecologists. I'm sure they'll help you. Congratulations anyway. Doctor, in bits and pieces throughout, we have talked about the treatment options, but now in detail, I would like you to throw some light over the treatment options available for urticaria.
The treatment options, the most important treatment options are the anti-allergics. Anti-allergics we divide into old generation and new generation. As one of the persons was talking about Atrex and cetirizine, the older generations are more effective in controlling itching, but they pass the blood-brain barrier, so they cause sedation. Neend aati hai. Now, if you are totally drowsy throughout the day, even if you're not itching, it's as distressful as it was having the itching. So the newer generation anti-allergics, the advantage is that they might be slightly less effective, like you might need to repeat it twice a day, but they are less sedative. So what we try to do, if somebody is very distressed that they're not able to sleep, then we give the old generation anti-allergic at night. Secondly, every medicine, including the anti-allergics, have a T half. T half means the time spent in the body by the drug. So if you take an anti-allergic, now I have started saying that take it at 7:30. It has nothing to do with food, because if you take it at 7:30, the T half is around 11 to 12 hours. So in the morning, you will not be groggy. If I tell people to take it after dinner, then the dinner happens at 11 and 12, and then they take the medicine at 12:30, and then they are groggy in the morning. So anti-allergics again have to be timed according to your schedule. And anti-allergics, as I said, Samyukta, everybody has a, there are people who don't have any sleeping issues with cetirizine. There are people who feel like too drowsy throughout the day. So the whole idea is that to find the right anti-allergic for you. And we might have to change anti-allergics every 3 days, but we will always give 3 days for the anti-allergic. We'll not blame it immediately that, oh, no, this is not suiting you. To see whether it's suiting or not, it takes time. Secondly, in the acute phase of urticaria, as I said, the prescription has to include a mild steroid, because steroid acts as an anti-inflammatory body, and sometimes the body is not able to handle the symptoms of urticaria without that. So this is the prescription. Dermatologist is the Supreme Court. The first of all is the self-medication. Secondly is the OTC, over the counter, then the GP. If everything is not treated, then everybody comes to us. So we get to see the patient when all other things have been done. So we are not in that position just to, give an anti-allergic and say, take care of it. So we give a whole prescription. And again, the request is that only, that kindly, once you are treated, don't wait and see, aaj nahi lete, let's see hota hai ki nahi hota hai, because it will spoil my 10 days work. So what I'm trying to do is making you cured, but you have to listen to me.
Yes, so please listen to your doctor and complete the whole course of the treatment. One more question on the same line by Ishita Jha. My husband has skin allergy urticaria for more than 6 months. Took many treatments, but not fully cured. Again and again, he is getting it. Is it fully curable?
It is fully curable, but as I said, that whether it will be 2 months, 2 weeks, 2 years, we are not able to say. But if you are taking, if you need an anti-allergic every third day, it's okay. Don't stress about it. Just take it.
Okay. Shah Nadeem is here, Dr. Shehla, asking what is the role of levamisole in urticaria?
Yeah, levamisole is something which the general practitioners prescribe a lot. It's a medicine which we use to reduce worms. Also, all these medicines, like in Corona era, you saw there were lots of ivermectin being used. We used it to cure. We actually use it a lot. Lots of dermatology medicines were being used. Ivermectin being one of them. We use it for lice and mice. Like in the sense, scabies and lice, we use and we have been using it for years, because all these medicines reduce the irritation of the skin. So similar way, levamisole is an old generation. Like I don't use levamisole now, I'll use ivermectin. So it reduces the irritation of the skin, the burning of the skin. If somebody comes to me and says, my skin feels to be burning, so there levamisole or ivermectin will be helpful. And these are stat doses, single doses. It's not a course. So we just give a single dose so that it reduces that inflammation.
Okay, doctor, as you just mentioned the word COVID, which we are going through from last two and a half year. Now, I would like to ask you, can COVID cause hives on face? Because many patients who went through COVID, etc., they complained of the same.
COVID is a viral infection. So the viral infections cause erythema. Erythema is different from hives. Erythema is just redness and feeling of warmth. So that is the body's way of coping. Hives is something where you actually have, as I said, itch will flare. Pehle there'll be itching, then there'll be redness, and then there'll be swelling. So COVID per se is not causing urticaria, but once you have had COVID, after that, because your immunity is less, and if you're exposed to something earlier which was not causing you urticaria, it might cause urticaria. Lots of people, Samyukta, started having pressure urticaria. If they were wearing the very tight garments, then when those garments, once they remove, there is a red line, and that causes urticaria. So lots of people who have not had the pressure urticaria earlier, once they had the COVID symptoms and after they recovered, the tolerability of the body has reduced over the period of time.
Right, fair enough. Doctor, one more thing, because you get to deal so many patients every day for urticaria. What are the common mistakes that they end up doing, and when they come to you, you're like, oh my God, I wish you would have come earlier, or not
Exactly.
ignored your symptoms, etc. What are those commonly done mistakes?
As I said, the first common mistake is ignoring it. Once you come to me and say, I've been having it for 2 months and I was taking cetirizine, you have already converted it from acute to chronic. So that is not there. If for 10 days you feel you are not getting okay, please visit a dermatologist. Secondly, using the wrong home remedies. As I told you, somebody had just come with a sunburn and had done the hot compress. So if your skin is already irritated and you're doing the hot compress, what happens is the layer burns off and then the nose is more red, and then we have to treat that also. Taking the anti-allergics without prescription is okay for a day or two. I don't want to promote it as such. Everybody is a self-doctor these days, but taking it continuously and not being bothered about it is another mistake. So thirdly, keep on itching or itch it out, like in the sense you are excoriating and there are scabs forming, then too you are applying aloe vera and calamine lotion. That doesn't work, because once the skin has become excoriated, as I always say, if I start itching here today, there'll be a scab form, because that is the voice of the skin saying, please stop itching. Because if you're itching and you're excoriating the skin, then that leads to a second level. And there is something called as LSC, lichen simplex chronicus, which happens very commonly. People have lots of itching on the legs, so it becomes a pastime. You're sitting talking and you're itching on the leg. It happens only on accessible areas. It will not happen on your back where your hand does not go. So these are the common things people ignore, and these are the things, because you have had LSC, lichen simplex chronicus, you are itching, the eosinophils increase, and once they have increased, they'll cause allergy everywhere. So if you have even a small spot which is not getting treated, if you don't treat it and you keep on itching, whenever you are itching, the itching cells are multiplying. So you have to don't do that.
Please don't ignore the symptoms. Go and consult your
Exactly.
doctor.
Exactly.
And doctor, as we are coming to the conclusion part, any parting note, anything that you would like to share with our
Yeah.
viewers?
Everybody, all of us, at some point of our life will get urticaria. This is a fact. Once you get urticaria, if it's okay within 10 days, 15 days, don't worry about it. Don't bother about it. Why me question doesn't come over here, because everybody has some or the other causes. If you are a patient of chronic urticaria, don't get frustrated, because it's very frustrating. I have done this, I have done it, will get okay. And there are very few, if there is a thing which does not get treated, why would I say that it will get treated? I will tell you very clearly that this is controlled. If you have sugar, high sugar, we'll tell you it is controlled. We'll not tell you that it gets away, it goes away. When I'm saying chronic urticaria gets away, because in 25 years of my practice and all the studies and the whole studies in the world, it does go away. So don't add stress to that. If there is anything, and especially in children, there is something called as atopic dermatitis, which is very distressing for the parents. बच्चा तो खुजली कर रहा है, but parents are the ones who get very distressed seeing the child in that discomfort. Sometimes, let me tell you, pruritus, the itching reflex is pleasurable. It gives you pleasure to itch your skin out. So don't do that. Don't make it a pleasure, a guilty pleasure. Apply the lotion, take the right treatment, stick to a doctor. If you don't like the doctor, change at the initial point, but don't go doctor hopping and shopping. So somebody has to take responsibility for you. And if you feel the other person is taking responsibility for you, then stick to them.
Yeah, very, very well explained, doctor. Thank you so very much, Dr. Shehla, for your valuable time. It has been very informative session for our viewers, and I'm sure they will use this information to prevent themselves and their near and dear ones from getting Artecteria. And in case if they get to see such symptoms, they now know that instead of self-medication, it's better to approach a nearby dermatologist. It was great having you with us. We really look forward for many more such sessions in coming times with you for our viewers. Thank you so very much, Dr.
Thank
Shah.
you so much, and thank you, Vistas, all technical team also. You can ask Samyukta to send them the questions. You can forward them to me. If it's in my purview, I'll definitely answer back. So sometimes the time is restricted. We are not able to take in all the questions, or somebody who sees it later, they're more than welcome to write to us and we'll answer.
Thank you so very much. We'll do that. Thank you so very much. And we would also like to thank our viewers for your active participation in today's session. To get latest updates on how to make your skin healthy, do like and follow our FB page all about skin allergy. We are also available on YouTube, Twitter, and Instagram. Goodbye. Good day.